And this week, the district released details of how it will oversee and operate its medical marijuana program. This comes some 2 months after the D.C. Council unanimously approved medical marijuana in D.C. Philip Stewart has a closer look at the new regulations and how they compare to other states.
They are massive, comprehensive regulations that detail how the district's medical marijuana program will be wheeled out. D.C. Attorney General Peter Nichols insists getting it right from the start is essential.
You want to assure that it just doesn't become sort of a novelty and everybody thinks, well, it's like cotton candy.
Among the 300 guidelines released, qualifying patients must be city residents, must register with the district government, and have a qualifying medical condition. The rules also include fines and criminal prosecution for patients who possess unauthorized marijuana.
You've got to be sure the public understands that you're putting a program together that will be enforced and will be conservative.
Also in the mayor's proposal, the establishing of a medical marijuana program and a 7-member medical marijuana advisory board. It also puts the director of the Department of Health in charge of things like marijuana dispensary registration and clinic inspections. District officials look to the 14 states that already allow medical marijuana for guidance, and experts say there is a lot to be learned from them.
I think it's important that we have a system that's being proposed here in D.C. that involves a lot of regulation and government involvement, rather than what we've seen out in California that's more of a hands-off approach, and the system tends to sort of spiral out of control.
Now, there are some critics of the district's plan. They're especially critical of how these dispensaries will actually be chosen and how few medical conditions will actually qualify for medical marijuana treatment. Now, many of these concerns are likely to come up as the city opens this issue up for public comment. That will last about 45 days, but if all goes as planned, medical marijuana could be distributed in the district as early next year. In the newsroom, Philip Stewart, News Channel 8.